All right, when we talk about those breakthrough infections, there obviously have been, notable infections, people being positive after being vaccinated. You look at the New York Yankees, for instance. But when you have someone so high profile like Colin Powell, who died from COVID complications, how important is it for us to have these conversations about breakthrough infections? And then I guess the sidebar of that, knowing that he, was suffering from cancer at the same time, to also talk about, chemo and immunotherapy and things of that nature when it comes to the vaccination discussion?
I think it's important to recognize two things. Number one is that no vaccine out there is 100% protective against anything, right? We're very, very fortunate to have such highly effective mRNA vaccines, in the high 80% for Pfizer, the low to mid 90s for Moderna, but no vaccine is 100% effective. We also know that the vaccines in general are somewhat less effective in people who are immunocompromised. And Secretary Powell is a perfect example of someone who was older, who was immunocompromised, likely taking chemotherapy, steroids, and radiation for the type of cancer that he had. And those patients are still at the highest risk. And that underlines the importance of making sure that everyone around these patients are fully vaccinated to minimize the risk. We should be clear that those who are unvaccinated are still, I believe, 11 times more likely to get sick and 6 times more likely to die from COVID than those who are vaccinated. So yes, I think there are notable breakthrough infections. We have to be aware of them, but they still pale in comparison to the rates of infection we're seeing of those who are unvaccinated.